Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about some frequently asked questions when it comes to weaning off of pain medicine. Hi everyone, so today we're talking about weaning from pain medicine. So in particular, we're thinking about after having knee replacement surgery, you're usually prescribed, in most cases, some sort of narcotic, pain medicine, prescription pain medicine. And it's important to eventually be able to wean yourself off of that pain medicine so that you're not taking that pain medicine and you're using other strategies to help manage any pain that you might have, such as over-the-counter Tylenol, Advil, something of that nature, or of course other pain management techniques such as icing, elevation, things like that. Now, the first thing I want to say is one, that it's very important to understand that these are just some recommendations, just some general guidelines. You really want to follow whatever advice and whatever is instructed by your surgeon, as well as the pharmacist who prescribes the medicine and provides the medicine to you. Follow those instructions first and foremost. This is just some general advice. My other thing I want to say is, if you are someone who has a lot of pain after surgery or before surgery, it's okay to take pain medicine. Don't feel guilty about it. Don't feel like you're doing something that's evil or bad, or you're a bad person, or you're not doing it right, or you aren't working hard enough, or anything like that. People have all sorts of different experiences when it comes to pain, and some people, they need the pain medicine, maybe just one prescription, a couple days or a week or so, and they're good to go and they can manage with other strategies. Some people, they might need a little more prolonged use of the pain medicine, and that's perfectly okay. Obviously, you want to use it appropriately, and the end goal should be to wean off of that medicine, as there are a lot of risks, things like being addicted to the pain medicine, having withdrawal symptoms, a lot of negative things and complications can occur with that medicine. So we obviously want to wean off of that and use alternative strategies for managing pain. But if you are someone who has to take some pain medicine for a little bit more prolonged period of time, for whatever reason that may be, don't feel guilty about that. That's just, each person is going to have a little bit different recovery, and that's okay. So talking about this, so why do we have to wean off of medicine in the first place? Well, the reason for that is, if you just immediately stop taking your pain medicine one morning when you wake up, your body is going to go through withdrawal symptoms. And this can be all sorts of different symptoms, but things like having sweats, having a temperature, having fatigue, things like shivers, trembling, things like this. There's all sorts of things that are symptoms of withdrawal and things that aren't very pleasant for the body and for you to experience and go through. So that's why we want to wean off the medicine slowly. And some things to think about is when you have pain medicine prescribed to you, you don't have to take all of the pain medicine that's prescribed to you. You absolutely can, and it's perfectly all right to, but there's certain medications like antibiotics where it's very important that you take all of the doses, all of it, the particular time that you're supposed to take it, because that's important for helping to eliminate that bacteria fully from your system. When it comes to pain medicine, you really don't have to take all of the prescription pain medicine that you're given. Talk with your doctor about this, but if you have 5 pain pills left in your prescription and you feel like you don't really need to use them, then I would recommend, then you don't worry about using them. Again, we have to use this weaning strategy, but you don't have to take pain medicine just because you have it and were prescribed it. So, you want to, again, you don't immediately want to stop taking pain medicine. So some ways to start to wean off of pain medicine is, one is looking at the dose. So for example, if you take 3 pills at a time, now you want to, next time that you're supposed to take your medicine, you take 2 pills at a time. And you maintain that level of 2, and you maintain that for maybe 1 day or 2 days. And then if your body is comfortable with that and you're able to tolerate and manage the pain effectively, then you go down to 1 pill every time you take your medicine. And you do that for a day or 2 days. And then maybe try to go down to no pills if you can. It's important to, not go 2 pills one time, 1 pill the next time. You really want to give it at least, 24, 48 hours of trying this lower dose before moving down to an even lower dose. So of course, the easiest way, again, if you take 3, start taking 2 and try that for 24 hours, 48 hours. If that feels good, move down to 1 and go from there. The other way, of course, that you can start to wean off of the pain medicine is looking at the duration of time in between when you take your medicine. So, for example, you may start out taking it every 4 hours. And then you decide, okay, I'm trying to wean off of this. So now you might increase it to, you wait 5 or 6 hours in between times of taking your pain medicine. And you do that for a day to 2 days. Starts to feel okay, starts to be manageable. You go, okay, now I'm going to wait 7 to 8 hours each time before I take my pain medicine. And you do that for 1 to 2 days and see if that's manageable and see if that's tolerable, and then move on from there. And you can increase it a little bit more to the point where you're not taking the pain medicine anymore and you're using different strategies. So those are basically the main ways to wean off of the medicine. So you're thinking either I want to reduce the dosage that I take, or I want to reduce the time or increase the time in between when I take my pain medicine. And you can also do a combination of these, which can be effective as well. So maybe one time you decrease the dose and you get the dose down to maybe 2, and then from there you might start to increase the time period between it that you're taking the 2. You can kind of mix and match between the dosage and the time in between taking the medicine. Important things, again, I kind of talked about this at the beginning, but you want to continue to do the other strategies that you are using to manage your pain. So if that's taking the over-the-counter medicine, Tylenol or extra strength Tylenol, Advil, things of that nature. If you're considering an anti-inflammatory, I would just be careful with that, an NSAID. Just talk to your doctor, talk to your surgeon about that, talk to the pharmacist, just to make sure that you're okay to do that. And again, there's the other pain management strategies to be aware of. So icing, meditation, mindfulness, exercises, range of motion exercises, stretching, heat, a lot of different things. Self-massage, massaging out the muscles in the areas around your knee joint, elevation, compression, all those great things. So again, we're doing this to try to limit and reduce the withdrawal symptoms of just stopping immediately taking pain medicine. And of course, it's very important that we want to have as our end goal to wean off of this medicine, just due to all the different risks and complications that are possible, unfortunately, with taking these prescription narcotics and pain pills. So thank you very much for watching, everyone. As always, I ask if you enjoyed this, please subscribe to our videos. Leave us a like, leave us a heart. If you have any questions or feedback or comments, I'd love to hear it. I always do my best to try to reply to any comments and all comments that I see. And thank you again for watching, everyone, and take care.